Before we go any further, please hit the like and subscribe button so you never miss an update. Here you are, perfectly relaxed as you attend the farewell party of Joe. Your boss comes up and asks, would you give the farewell speech to Joe in 10 minutes time? I can't, you splutter, my vocal cords are paralyzed. And the fear kicks in. I can't do this. I must be crazy. That doesn't work, so now you wait for the floor to open up and swallow you. That doesn't happen either. Public speaking creates a great deal of anxiety in most people and arises when they face the prospect of giving a speech, particularly for the first time. The truth is that public speaking is always a mixture of terror and exhilaration. For everyone. It's just like snow skiing. When you start, all you can think about is how awkward you are, how dangerous it is, and how you'll never be able to do this. You get one turn right, get up a little bit of speed, the snow starts to fly in the sunshine and a tiny bit of excitement pops up. Later, as you become a more accomplished skier, the balance between terror and exhilaration changes. Now you are zipping down the slopes, carving those turns and feeling like an Olympic champion. But there is always that little bit of anxiety lurking, as you speed across the snow. If you are one of those living with panic attack symptoms, you know it can almost take over your life. Living with the fear that you will have to suffer through another period of grief, pain, and discomfort is sometimes enough to bring on a panic attack. When it comes to treating a panic attack, some medication has been known to significantly reduce the symptoms, enabling people to continue living a life that is not ruled by the fearful unknown. The following provides information about some of the most effective medications available to consumers. Number 1, alprazolam. This medication is one of the more common prescriptions for general anxiety treatment. It is a benzodiazepine, which is used to treat short-term panic attack symptoms in many people every day. This medication is not meant to treat ongoing and daily forms of a panic attack, but is very useful to people who experience these symptoms periodically. Number 2, azapirones. Azapirones is a drug which works on the central nervous system by relieving the many symptoms of anxiety. This drug can be found in many antidepressants and is the reason many people who normally would not take antidepressants do, because of their panic attack symptoms. It is used to calm the nervous system, putting it somewhat into sleep mode. Number 3, benzodiazepines. This is a tranquil medication, used to help fight anxiety and insomnia. The drug is very potent, and a fear of becoming addicted to it is shared with both physicians and patients. For extreme cases of anxiety, this is the medication most commonly used, but it's also something that can significantly alter your mood or personality if not used properly or for longer periods of time than prescribed. Number 4, selective serotonin reuptake inhibitors. These are a newer type of antidepressant introduced into the US in the 1980s, beginning with Prozac. They work differently to traditional antidepressants, and they do so by increasing and assisting the brain to maintain levels of the neurotransmitter serotonin, which is often found to be low in people suffering from depression, obsessive-compulsive disorder, OCD, and anxiety and panic disorders. Typically for beginners in public speaking, all we experience is the terror. Waiting for our turn to come, starting our speech, the terror remains. This seems to consume us, makes us irrational, and we often feel paralyzed. Then somehow we get through the presentation, come from the stage, and as the numbness wears off, the next feeling we have is relief that the ordeal is over. However, we still retain a sneaking regard for our courage in making that speech, and a small glow of exhilaration starts to burn within. Particularly if we can stop saying to ourselves, how bad we were. In fact, as you walk from the spotlight, say, well done indeed, to yourself. Why? Because it's true. With more practice, the amount of terror reduces and the amount of excitement increases. Now you do another speech, another presentation, and pretty soon you actually realize that you are enjoying this and you become amazed. And slowly you become hooked on the excitement of giving a speech. So much so that when you go to fridge in the night for a drink, the fridge light comes on, and you give a 5-minute presentation. And then the fun starts to creep in. And by the way, if you do not have any nervousness or excitement just before you speak, you will come across to your audience as flat. Did you know that some of the greatest orators in the world have been known to be physically sick before giving a stirring speech? So, always be kind to yourself. You will get better with every presentation that you make. But you have to make the presentations. So learn the information and then simply do it. That is all for now. If you find this video helpful, please hit that like and subscribe button, and press the bell icon, so you never miss an update again.